terms of staging, so we look at the risk. So this picture is again showing the different layers of the bladder, and the most superficial layer is the urothelium, the lamina propria, then the muscle is that middle layer where it's higher risk, and then fat is above that, and that is also higher risk. So it's really important for us to know when we see a bladder tumor, how deep is it going? And sometimes we only find that out when we have the biopsy results and the pathologist looks under the microscope to see how deep is that tumor going. Other ways to determine this stage are CT scans. So on the left-hand side here, you have, and think of a CT scan as a cross section. So cutting across your midsection, and you're looking down into the body here, and the middle gray circular area here is the bladder. And here on the left, it's normal. And then here on the right, you can see that there are some changes within the bladder here, and that is suspicious for cancer. CT scans can also help tell us, has the cancer spread outside of the bladder? And so here in the CT, you see a mass and then a lymph node nearby, which is where there's suspicion for an enlarged lymph node, which is usually the most common area that a cancer will first spread outside of where it started, is the lymph nodes. And in this scan here, you can see that the cancer has indeed potentially spread into that lymph node, and that's concerning for more advanced disease. Going back to the earliest stage of bladder cancer, non-muscle invasive bladder cancer is when it's only in that superficial layer of the bladder. And those ones can usually be scraped away with the tumor, the TURBTs, which the urologist does. And sometimes if they're higher risk, they're also going to place a solution or chemotherapy into the bladder. So most commonly, BCG is a type of treatment that can be instilled into the bladder, and that can reduce the risk of the cancer coming back if it's an early stage or superficial bladder cancer. Sometimes they also can do chemotherapy within the bladder. And there's other newer treatments too, and definitely talk to your urologist about the options for non-muscle invasive bladder cancer, because they'll be the ones primarily managing this. And it may require following up with the urologist every few weeks or every few months to take a look in the bladder, scrape away, or instill more of these solutions or chemotherapies into the bladder itself when it's superficial and it hasn't spread beyond that inner layer of the bladder.